Hello, everyone. Thanks for joining us on the media briefing today. Let's go ahead and get started with our first topic, which is COVID-19 information, and Dr. Moreno from our health department. Good afternoon, Dr. Moreno.
Hi, Mia. Good afternoon.
Good afternoon. Do you have any updates for us, or are you ready for some questions?
Yeah, no updates this week, but I can take questions from the media.
All right, I've got some questions already received, and anyone who has questions for Dr. Moreno, go ahead and submit them by chat. So let's go ahead and get started. First question for you, Dr. Moreno, will there be increased testing capabilities before and after Christmas and New Year's?
That's a good question. I think anyone that's looking to get tested now or through the holidays can go to the website. You can start at our website and look for testing sites that are convenient to them and sign up for tests. I just want to remind people that people can be tested for free at certain locations like the OptumServe sites. And our testing turnaround time in most locations is still pretty good here in Monterey County. So I have not heard of any challenges with people getting tested. So I encourage people who want to get tested or are required to get tested to go ahead and visit our website. And you can also call 211 for assistance in setting up an appointment to get tested.
Sorry, that was me on mute. Let me go ahead and ask that question again.
Sure.
What do you recommend as a testing protocol for those who are celebrating with family and friends or who may be traveling?
I would recommend people visit the California Department of Public Health website for guidance, because the guidance for recommendations for testing can change over time. So for the most current recommendations, I would recommend people go to the California Department of Public Health website. Also, there's information on the CDC website on testing, and it really depends on your situation. And you can, on those websites, you may be able to find if you're help in determining whether or not to test if you're traveling locally, traveling to other states, or traveling internationally to other countries, particularly countries that have high rates of COVID.
Thank you, Dr. Moreno. Next question. Is the state's indoor mask mandate warranted, in your opinion?
The state health officer has the authority to issue his or her orders for the entire state, and the case rates are higher in some parts of the state, and some regions are having an increase in hospitalizations and getting close to their capacity. So the state health officer in his authority has issued a health officer order with specific guidance for the entire state.
Thank you. Next question. Has Omicron, the Omicron variant, arrived in Monterey County yet?
We haven't received any reports of specimens testing positive for Omicron variant at this time. However, the Omicron is being detected in greater numbers and in a growing number of states. And so there's a very good likelihood that the Omicron variant is here in Monterey County, but as of yet, we haven't received any reports of Omicron being identified through genome sequencing.
Thank you. Next question. Should we expect an Omicron surge in Monterey County, or can we?
I don't predict the future in terms of surges, but based on what we know that Omicron is being detected in a variety of countries and several states here in the United States, and we should continue to do what we can to prevent spread of COVID-19 here in Monterey County until we learn more about the Omicron.
Thank you. And I have a question about enforcement of the state mandate. Can you talk a little bit about when a state order goes into effect, how is that enforced?
So we've been under state health officer order now for quite some time during this pandemic. And the health officer order for the state applies to all counties and cities in California. And the order is issued in this instance to try to address the increasing cases and hospitalizations in some of the regions, in multiple regions here in California. So I highly encourage individuals to follow the health officer order, encourage organizations and businesses to be familiar with the health officer order and implement the health officer order both here, and if anyone travels to another county, keep in mind that the health officer order applies in all counties across the state. So encourage people to comply with the new order here in California.
Thank you. And then that was the last question that I have for you. Are there any other questions for Dr. Moreno before we let him go for today? Here, okay, I've got another one for you. Given the county did not have an indoor mask mandate before the state order, how do you think this new state order would impact Monterey County?
Prior to this new health officer order, Monterey County has been under a state health officer order requiring everyone that's unvaccinated to wear a face covering in indoor public settings. And we've also been under a health officer order requiring people, both vaccinated and unvaccinated, to wear face coverings in certain indoor settings, such as correctional facilities, jails, homeless shelters, all healthcare facilities, transit, just to name a few. So Monterey County has lots of experience being under a health officer order. This is a modification of the health officer order requiring, at this point, in addition to all those individuals that were previously required to wear face covering indoors, now it also requires individuals who are vaccinated, regardless of the setting, to wear face covering indoors.
Thank you. Any last questions for Dr. Moreno before we let him go for the day? Going once, going twice. All right. Thank you very much, Dr. Moreno, and we'll see you next week.
Okay, I'm here.
So I am checking in. Is Roxanne Wilson on I've got a phone number that I don't recognize. Is that you, Roxanne? No. So I hope Dana Edgell doesn't mind going a little bit earlier than expected. We've got Dana Edgell from our Monterey County Behavioral Health Division and Karen Smith, our Public Health PIO, to talk a little bit about some mental health awareness, a mental health awareness campaign, and then help us walk through what we might expect as we gather this year, some possibly for the first time in a long time, with relatives, which could really take some navigating. Good afternoon, Dana.
Good afternoon. Thank you so much for inviting me and Karen to speak together with you today about some really important topics. I'm also going to share some information about a new statewide mental health campaign. And I really appreciate the partnership that we have with you, Maya, and with the media. There are many individuals in Monterey County who rely on our media outlets to get important, timely information. And you can really help us in spreading the news about the new mental health campaign, along with some information on coping during the holidays. And we know that COVID and the pandemic really has had an impact on our mental health and well-being. Before the pandemic, estimates in the US are that tens of millions of people each year suffer from mental health conditions. And only half of the people that have treatable mental health conditions ever get the treatment that they need. And this is in large part due to stigma around mental health and substance use disorders. And in partnership with our media, we feel strongly that we can get the word out that there is no stigma, there should be no stigma, and there is no shame in having a mental health condition or a substance abuse addiction disorder. We know that our youth and our young adults have also been impacted by the pandemic. And we're seeing a rise in emergency room visits for mental health conditions for adolescents and for children aged 5 to 11. And so we really need to help family members get information that can help them to address not only their mental health and well-being, but their children and their youth, the mental health and well-being. And just one last point before I launch into showing you some information about the current campaign about taking care of yourself during the holidays, and the new campaign that is Take Action for Mental Health. I want to emphasize that there are vulnerable populations that the CDC recommends that we focus on, such as younger adults, racial and ethnic populations, essential workers, and unpaid adult caregivers, as these individuals have disproportionately higher rates of mental health, substance use, and elevated risk for suicide. So our partnership with media is so critical because you often reach into families and individuals' lives in ways that the health department and behavioral health doesn't. So Karen, is there anything that you'd like to say before I show a short presentation?
No, go ahead.
Okay, all righty. So bear with me. I'm going to try and show you a short presentation. Maya, are you seeing something that says coping during the holidays and beyond?
Yes, you're there.
Okay, great. So there are two campaigns that we're going to talk about today. One is the Take Action for Self-Care. And this is really focused on tips for during the holidays. We have information currently on our health department website, as well as by the end of the week, you will have information on all of the tips which go into January that will help people really to focus on self-care in a variety of ways. So stay tuned for that. So these are the logos for the new Take Action for Mental Health campaign that are part of statewide efforts. And I'm going to show a short 1-minute video that will provide an overview of the campaign. All right.
California is talking about mental health. Since we launched Each Mind Matters, California's mental health movement, millions of people and thousands of organizations have been working together to reduce stigma and discrimination, prevent suicides, promote student mental health, and raise awareness. Now that mental health is on everyone's mind, it's time to take action. To check in, to learn more, and get support. Take Action is the new phase of Each Mind Matters, with a new look and a new campaign that will go from changing the conversation about mental health to inspiring people to take action. Let's get started. Brought to you by California Mental Health Services Authority on behalf of California County and City Behavioral Health Departments.
So I'm hoping that you all saw that. My screen view did not change at all.
No, we didn't. We heard it, but we didn't see it.
Okay. Well, how about this? I think the main thing is you heard the main takeaways, and I have a slide that shows the different areas of the campaign. And some of the important takeaways, as you heard, is it's really a 3-pronged approach where the focus is to check in. And that means that we're both checking in with ourselves, we're checking in with our loved ones, we're having conversations around how we're doing. How are you doing in your day-to-day lives? We know that so much is going on for a lot of folks in our communities, and we want to make sure that people are feeling comfortable to have conversations with one another, and also to be mindful yourself of what's going on with you. And then learn more. Part of destigmatizing topics is to really understand them. And so there's a lot of great information on understanding mental health disorders, on recognizing early warning signs, so that we know when we need to get maybe some more professional help, as well as when we might be at risk, and we can focus in on some of our coping skills and strategies. And then a big part of the campaign will be to make sure that people know where to go in Monterey County. Well, this is a statewide campaign. In Monterey County, we're really focused on making sure that people know where to go to get the help that they need. And that will also be a part of what we're doing locally with revamping our behavioral health website. And so we wanted to shift gears a little bit and really focus in on self-care. And self-care is not a luxury. It's not selfish. It really needs to be the foundation for our health and our well-being. We know it's really common, and all of us do this when we're maybe feeling a little stressed out or exhausted or fatigued. We do something to help us feel better in the moment. So we will maybe grab an extra cup of coffee, or we'll take a nap, or a lot of folks will turn to having an alcoholic beverage, and some folks will turn to substances. And that's because we want to feel better. Now, while that all can happen for individuals, and again, it's part of our lives where we're drinking coffee, we're taking naps, we're taking a hot bath, it's important to remember that that's more self-soothing in the moment, and self-care really needs to be foundational support that you have in your life on a regular basis. We have a few additional tips for taking care of yourself during the holiday season. These are tips that come from the Mayo Clinic, and focus in on being aware of what's going on with oneself, acknowledging what's happening. For some people, the holidays are a stressful time. They can bring up thoughts of loss. A lot of individuals in our community have experienced losses. And so this can be a mixed time for people, and it's okay to be happy and to celebrate. And it's also okay to not be okay. And so knowing what's true for you and knowing how to be a support and really listen to the loved ones in your life is very important, always, and especially during this time. We really love the quote that's on the tip number 3. And again, these are going out into the community through email and social media and messaging through the health department and behavioral health, and they will all be on our website. I encourage folks to take a moment to read the tip number 3. And so, Karen, I'm going to hand things over to you to speak a little bit about how do we handle things like differing opinions on COVID vaccines, as well as Karen and I have talked a lot about how do we make sure that the people that we care about in our lives who are experiencing substance abuse and addiction disorders, they're still part of our lives and our family systems. And so how can we be in relationship and really support our loved ones during this difficult time?
So I think the word for the day is boundaries. Whether it's someone you love who has a substance abuse problem or someone you love who has a differing opinion about the COVID vaccine and masks and the controversy that surrounds that. Know your boundaries and set your boundaries. And it's hard. I'm not saying this flippantly. It is difficult to set boundaries, especially when you know that this is somebody that you care about, that you don't want to hurt their feelings. But, you know, it goes back to self-care is not selfish. So set that boundaries. It can be done. You might have to come to you may have to come with the masking the vaccines. You may have to come with you may have to lay down some specific rules, which includes masking if you're not vaccinated, if you're going to have a large family gathering and it's a mixed group, consider getting tested. And consider, once you get that out of the way, not necessary to stay in the moment, focus on the tradition and not on the controversy. So that I think all of us, what we want is a happy holiday. Although even wanting that understandably can be very difficult. So boundaries is the word for the day. That's also when you're dealing with somebody who has a substance abuse issue, especially if they're an active abuse. You can love people from a distance. You can say, I will do X, Y, and Z. Here's the criteria. I love you, but. It's difficult. You're not alone. There are many, many people who have loved ones who have abuse issues. It does not make them, we talk about stigma. And we often don't talk about this. Well, we often don't talk about people with mental illnesses or people with substance abuse issues. So it is very difficult, and there's a bit of shame that goes along with it. And often that makes it difficult. You love your child, or your parent who has the addiction issue. You don't like the disease. If it is a disease, it's hard to separate the two. I'll be the first one to admit that. Full disclosure, I have a son with an addiction issue. It is very difficult. Love him, or as my mother says, I will pray for you, not pay for you. So that's her boundary. You have these boundaries. It's difficult, and it's okay to grieve. It's okay to grieve the things that you thought you would have. It's okay to be sad that that individual maybe isn't at your table for a special meal. That's okay. No, you're not alone. Consider looking for Al-Anon or something along those lines to help give you support, because there are more people out there. So no, you're not alone. There is power in that. And knowing your limits and understanding, I think Dana said this before, that, yeah, it's hard. That this is a hard season for people, because you want to be happy. You want to have the glossy magazine layout, but it's not that easy. And when you don't, you kind of feel disappointed. But you got to. That's okay. It's okay to feel disappointed, and then it's okay to look at it and go, "Well, I'm grateful for what I have," and move on. I am not a psychiatrist, a social worker, or anything. I am a public health information officer. So those are just from my experience and my lived experience. And I want to just echo what Dana said, that self-care, take a stop, take a breath. Self-care is not selfish. And we just want everybody to have a safe and happy holiday. And from my public health side, I'm going to say, please wash your hands. And I'm done.
Thank you, Karen. And I just wanted to end with this last slide. I apologize for some of the challenges with the video, and I don't know what was happening with my screen, but we really value our partnership with the media. We know this is hard work that you do. We really thank you for partnering with us, for shining a light on topics that support the mental health and well-being of Monterey County residents. And to know that Monterey County Behavioral Health, we're your partner, we're your resource. And I have our website, www.mtyhd.org/BH. So thank you so much.
Thank you very much, Dana and Karen, for not only sharing information, but those personal stories that really touch people who may be experiencing the same thing. Does anyone have any questions for Dana or Karen on this before we let them go? If not, you know where to reach them. I think most of you. And then thank you both again. And then finally, we're very pleased to have Roxanne Wilson with us. She is the Executive Director of the Coalition of Homeless Services Providers. She's going to tell us a little bit about the upcoming homeless point in time count, the planning for that, and the need for volunteers. Hi, Roxanne.
Good afternoon. We are now in afternoon. Hello.
Thank you for time checking me.
It's been one of those days, so I'm happy to be here. Thank you so much for allowing me this time. This should be very short, really. It's just as the Continuum of Care representative agency, the Coalition of Homeless Services Providers is preparing for the 2022 point in time count, which will be conducted on Thursday, January 28th and Friday, January 29th. This is a very important activity which produces much needed information to help our community understand our local homeless crisis, which in turn drives funding and decision-making on project selection and design. To effectively accomplish this activity, the coalition is seeking approximately 200 volunteers to assist with combing the streets in the early morning of one or both days. In 2019, we counted 2,422 people experiencing homelessness in Monterey County. However, our database indicates we serve more than 1,000 more individuals in 2020. So funding for our population could substantially be increased if we could align the count with more realistic numbers presented in our database, meaning more services and more housing for the most vulnerable neighbors in our precious community. We believe that increasing our volunteers could help us do exactly that. So please note that the safety of our volunteers is our number one concern, especially with the new variant spreading throughout the world, which is why we request that all volunteers provide proof of vaccination. In addition, the enumeration will be completely digital, which is the first time we've done this ever. And volunteers would need to have vehicles and working cellular devices with internet service so the app could be downloaded. Volunteers are also encouraged to pair up with someone within their household to reduce the need for us to intermingle households. And finally, all of the trainings will be provided virtually leading up into the count. So if anyone is interested in assisting with this count, they could just visit us at our website, which is www.chsp.org to sign up. That's kind of the gist of what we have going on. But I really want to focus on the importance. There has been a lot of money that has been filtering down from the federal government and the state government during the pandemic. All of those funding streams were tied to our 2019 point in time count. And in 2020, when we were supposed to, or I'm sorry, it was this year, 2021, we were supposed to do the point in time count again. However, because it has to be conducted the last 10 days of January, we had decided that we were not going to do it, because if everyone could remember what January looked like at the beginning of this year. So again, it's just really important that we get the word out there and that we generate volunteers and interest in doing this count. And if there's anyone else who has any, further requests for me, I'm going to put my information in the chat and you guys could email me directly.
Thank you, Roxanne. I was also thinking you might share a little bit about what it's like to do the point in time count, because you talked about getting people together, going, you've got this COVID safety protocols. There may be people who are working, who have a regular work day, but this happens really kind of outside the regular workday. So someone could actually fit this in advance of their workday and still be able to help.
Yeah. So we will start the count at 5 o'clock in the morning. And the intention of us doing 5 o'clock in the morning is to really reduce the possibility of double counting. Most folks who are sleeping outside are still sleeping at 5, but as soon as day breaks, closer to around 6 or 7 o'clock, when traffic picks up, people will start getting up and collecting their items so they could move on from wherever they were sleeping. Volunteers also have the option of selecting their track. So it is very possible for a volunteer to select a smaller track, which is maybe near their employer, so they can get that count done prior to them going into work. Historically, we've had volunteers want to do numerous tracks, which those folks we asked would wrap up by no later than 10 o'clock, but our target is really 9 a.m. And for the first time, as you may have heard, we're going to conduct the count over 2 days, which we got approved by HUD. The intention of doing that is so we can hyper focus on rural Monterey County on one day and urban Monterey County on the other day. We also do the count in San Benito, but because San Benito is such a smaller county, we're going to count on Thursday, which is the same day as Salinas all the way down to Pacific Grove. There's a lot of flexibility in how we assign this. If anyone is interested in volunteering and they just have questions, again, they should definitely reach out to us. I'm going to put our general information here, info@chsp.org, inside of the chat as well, so they can ask us anything that they need to feel, to confirm that this is a good volunteer opportunity for them. Another thing is, high school students are often required to do some sort of community service. So if a parent and a student were to pair up and maybe go select a track where you're not trekking down, the railroad tracks in Salinas, but maybe something a little more quaint and small through a neighborhood just to get that done. That is something we could obviously work with our volunteers to do as well, is just choose like more, I don't want to use the word safe, but more targeted. There you go. Targeted tracks.
All right. Are there, before we let Roxanne go, are there any questions that anyone might have for her? You can go ahead and put any, she's put into chat contact information if people are interested in, I think in terms of sharing for the public, the info at chsp.org would be a really good, email address for that. Any other questions for Roxanne? I think we covered it, and I'm really glad to see it expand to 2 days. I'm really glad to see that we're kind of taking those two sections of Monterey County and really getting into the weeds in terms of those numbers. And I think people, I really am glad that you highlighted the importance of the count for the dollars that we have to spend to assist people, because I know there have been years we wondered, how can those numbers be right? And we want to get the right numbers so we can right size the money, right?
That's correct. And we've been making other moves leading up into this. So we have been actually virtually tracking encampments throughout both counties via a geolocation app called Esri. And we have outreach teams. We've ramped up our outreach teams. Before we maybe had 2 in our community, and now we have not just population specific outreach teams like youth and veterans, but we've also now have county-wide outreach teams. They have all been tracking this information, and we've been working with police departments and Caltrans and fire departments so we can really understand where people are located. I do firmly believe that we will get the closest count we've ever done, just because of the methodologies that we're using. We are we are paying people within encampments to tell us how many people are within those encampments, because usually it's all visual. So let's just say you see 10 tents, you will make assumptions about how many people are sleeping in those 10 tents. But there's no way that you would actually know. It could be 10, it could be 5, it could be 28, who knows? So we believe that by paying people that we built rapport with over the past year and a half to help us with these counts, we will again get closer to what we believe is the real number.
Thanks very much, Roxanne. I don't see any questions for you, but I think we covered all the really high points, and really looking forward to the results from next month's count.
Thank you so much.
And thanks everyone for joining us on the briefing today. Our next briefing is next week. We'll see you then.